Welcome to Healthcare Experience Matters. This podcast is brought to you by the Healthcare Experience Foundation. And with today's episode, we're teaming with PRC. This podcast is dedicated to transforming the healthcare experience so that every person can receive and deliver the best care. And we are back on the Healthcare Experience Matters podcast, joined today by Healthcare Experience Foundation co-founder and president, Katie Owens. Welcome back to the podcast, Katie.
Hi, Casey. Thank you so much.
Today's discussion is going to center around physician loyalty, but I'll just have you remind our audience briefly before we get into the heart of today's discussion, if you could just tell us a little bit about yourself and your professional background.
Sure, Casey. I'm especially excited about today's topic because it hits near and dear to my and our team's hearts. By way of background, I have spent the last 12 years coaching hospitals and health systems, and a huge portion of my time is spent working with physician leaders, frontline physicians, advanced practice providers, aspiring physician leaders, ranging from leadership development skills to communication, advancing patient experience and quality initiatives. And at the heart of how we get there is through engagement and loyalty, which is why I'm so excited for today's podcast.
As am I, Katie. Thanks for that introduction of yourself. So how would you describe physician loyalty?
So we have the opportunity through our partnership with PRC to spend a lot of time looking at national and local facility needs with physician loyalty. And at the core, it's an emotional and professional connection to an organization. We're looking at things like physicians feel committed to investing thoughts and ideas into the hospital health system, clinics, caring about the success of the hospital and clinic environment, feeling a sense of ownership and feeling that their role is rewarding.
Based on what you've seen in your line of work, do you think organizations are starting to better realize the importance of physician loyalty?
Sure. So, Casey, I think if 2020 and 2021 has taught us anything, is that we have to double down on our focus on physician engagement, loyalty, and support our medical staff and advanced practice providers with tools and resources to feel engaged, to feel a sense of motivation and commitment, and to reduce some of the signs of compassion fatigue and burnout that we're seeing is all too prevalent nationally. In our research with PRC, we have demonstrated that when physicians feel that an organization is an excellent place to practice, they are 4 times more likely to recommend that organization to their peers, to their patients, and to their own loved ones should they need care.
So do you think it's important that physicians feel an emotional attachment to their hospitals or institutions of employment?
Casey, I have the opportunity to look at comments and physician engagement surveys through PRC and national trends, and I think unequivocally feel that the answer is yes. Physicians want a healthy climate to practice in. They want to feel like they are a part of a team. They want to have a healthy relationship with administration. And, at the surface level, there's a lot of intellectual and practice-based needs. But at the end of the day, we want to create environments, and physicians say it's an important environment to feel emotionally connected to the success of a team and to an organization. As creatures, as human beings, we are emotional beings.
Can you describe some of the key drivers of physician loyalty?
When we look at predictive analytics, where physicians will say that they feel that commitment to an organization where they are loyal, there's 3 big drivers. The first and foremost, our research demonstrates that physicians want to practice in organizations where they feel the patient experience is a top priority. Second driver is a sense that administration is responsive to the physician's voice when there are needs, when there's concerns, when there's complaints, that they have that voice, that it's respected, that it's acted upon, when reasonable. And the third thing, and this is becoming more and more important as the pandemic marches on, is that there is a high degree of confidence in nursing care, and they feel a sense of confidence in nursing's treatment of patients, care and treatment of patients. And so those three components, working in an environment where patient experience is a top priority, administration is responsiveness, there's that connection to leadership, and their strong nursing care gives physicians a sense that their patients are in safe, good hands.
Based on some things that you've seen in your line of work, but how do you know? How do you track? How can you get a gauge on whether or not physician loyalty is lacking at your institution?
Because we have the opportunity to partner with PRC, we know with confidence that when an organization can conduct a proven physician engagement survey or periodic pulse checks, this allows us to very precisely understand and quantify the state of physician engagement, specialties that are more or less engaged, and formulate concrete action plans to advance the culture of the environment of the place to practice medicine for organizations.
When it comes to improving physician loyalty, where do you recommend getting started?
I think you've got to start with a baseline. You've got to start with making the commitment to survey or poll your medical staff, find out where, in an unbiased way, what are your strengths and vulnerabilities, and then being transparent with the results to share, hey, here's our opportunities that you have shared with us are incredibly important for us to focus on. And that practice in and of itself sends a crystal clear message that we care about your feedback. Here are the results, and here's what we're going to partner with you together to address to improve.
Katie, is it ever too late to improve physician loyalty?
That's a bit of a hard question, because at the end of the day, that's almost holding up a mirror to any given team to say, is this worth our time and investment? And that's a deeply personal answer for any senior team. I can't tell you how many times I have been in conversations with teams that say, well, if we ask, then we're on the hook to do something about it. And we don't know if we're prepared to do something about it. And to that, I say, then don't ask. But to really hold up the mirror and say, is this the type of culture where you feel equipped to really earn physician loyalty, to earn the referrals of independent medical staff, to have an engaged and productive employed medical staff model? That's just, at the end of the day, a very personal question that each senior team needs to ask. What I would also say is that engagement is a high standard. It means we're going to commit to evolving our culture to this pursuit of excellence. There are some organizations where there's an incredibly contentious or toxic environments or extremely high levels of burnout. And it just means you have to start at a different place to break down some of those barriers, to rebuild trust, to resource this work, to start to pursue engagement. It's kind of eating the elephant one bite at a time.
Katie, this has been another great discussion on the Healthcare Experience Matters. Again, we're talking to Katie Owens, president of the Healthcare Experience Foundation, about why physician loyalty matters. Katie, I'll just ask if you have any other final thoughts before we wrap up today's chat.
There's this emerging body of research that's demonstrating that engaged physicians lead to happier, more satisfied patients, lead to better quality outcomes, lead to more market share growth in terms of referral sources. And this is a starting point. This is beginning the conversation and making a commitment to do things like senior leader rounding on your physicians, an annual engagement survey, pulse checks, demonstrates more than the tactics of a survey, but the willingness to listen, be open, and to continually strive to address the operational, cultural, and interpersonal components that create an engaged medical staff.
Thank you for listening to today's episode of Healthcare Experience Matters. Healthcare Experience Matters is brought to you by the Healthcare Experience Foundation, with today's episode teaming with PRC. To learn more, visit healthcareexperience.org. That's healthcareexperience.org.